Hey guys, this video is for EMTs that are trying to figure out when is the right time to call for ALS backup. Well, basically, the answer to that question is in your protocols. It tells you, under these circumstances, request ALS backup. But on the street, I understand you don't want to be that EMT that's always calling for backup. So in this video, I'm going to clarify to you some instances and how to handle this situation. So first and foremost, follow your protocol. If your protocol says to do it, do it. A way to work around it is, and you want to cover yourself, I see a lot of EMTs, what they do is, if the hospital is 3 minutes away and the paramedic's ETA is 5 minutes, they request it so they could document that they requested, but they expedite transport to the nearest hospital because their ETA to the hospital is much quicker than the paramedics. So in this case, they do what's best for the patient by expediting transport, not waiting for an advanced life support ambulance. And on top of that, they cover their bases by following their protocol and doing what the protocol says, which is request ALS. Now, if you don't request ALS under these circumstances, just document it appropriately and explain yourself, and you'll be fine, right? Next instance where you should call for ALS is when you're not sure what's going on. For example, the other day, a BLS unit called for backup. They didn't know what was going on, and it turned out to be a stroke, and it was not an obvious stroke. Our clinical eye, plus the partner I was working with, who works on the stroke vehicle here in New York City, was able to see it because she had been seeing so many strokes for the last couple of months that her eyes were much more delicate. She had the eyes of a neurologist when it came to having a presumptive diagnosis for a stroke, right? Another instance, a person that we had was not acting properly, and the BLS was unsure of what was going on. And when we put this person on the EKG, she turned out to be having a heart attack. So I say that to say this: the instinct on these EMTs was correct. They weren't 100% sure what was going on, so they requested backup, and we went and we were able to help them, right? But on the flip side of things, you also don't want to be the person crying wolf. So I say that to say this: if you're EMT who wants to play hot potato and pass the patient on to ALS every single chance you have someone with a cough, then that's something that'll get you a bad reputation within the streets. You don't want to be that person. You don't want to be a BLS that requests backup all the time, because when you really need it, then the paramedics are probably going to drag their feet knowing that it's you that's calling all the time. So call when you have to call, obviously. Call when your instincts tell you that you should call. And last but not least, if you feel like it's the best thing if your patient, then by all means, do what you got to do and call for backup. Because if you arrive on scene, and if a paramedic arrives on scene, at least for me and the partners I work with, if we arrive on scene and we see that there's a sincere, genuine example of patient advocacy, and you're just trying to do what's best for the patient, and that's why you called us, we're not gonna get upset. You know what I'm saying? And if a paramedic does get upset for you trying to do what's best for the patient, then don't pay that person no mind. That person's a jerk. You know what I'm saying? So just do what's best for the patient and you'll be fine. Don't worry about nobody judging you. All right, guys? I hope this helps. Peace.